I'm community reporter Ashley Stevens speaking with local organizations after the Trump administration canceled more than $125 million in grant funding dedicated toward health research for the LGBTQ plus community. And they say this will have an impact on the Central Coast. According to a recent survey done by the county, within the last year, local LGBTQ community members thought about suicide at triple the rate of their non-LGBTQ peers. While Transitions Mental Health has seen an increase in crisis line calls, the suicide prevention hotline dedicated to LGBTQ plus youth, 988, is targeted for cuts.
Suicide is the second leading cause of death for youth 10 to 14, and I believe it's third for 15 to 24. So that's a public health issue, right? If our youth are dying of suicide, that's something that as a larger community, I think we're concerned about and we want to pay attention to.
Mental health clinical director Megan Boaz Alvarez says Transitions Mental Health, along with other agencies, will have to start sunsetting programs depending on priority level.
What I see is kind of a sweeping dehumanization of a very large, very important, very real group of humans.
Public health cuts are also associated with places like Lumina Alliance that provide support for victims of crime, and they were informed a resource center for victims was defunded and closing down.
The way that our funds are being restricted, it happens almost simultaneously, and as well as we're looking at, it's like that fear of what's going to come next, right? We're truly living in survival mode right now.
Multiple agencies have said federal changes are not only changing on a day-to-day basis, but by the hour. Resources for LGBTQ plus youth and community members can be found on this story on KSBY.com. In San Luis Obispo, Ashley Stevens, KSBY News.